The United States Institute of Medicine issued a now famous report, Crossing the Quality Chasm. This was an iconic shot across the bow of U.S. healthcare. The report describes 6 dimensions of high-quality healthcare, and in every case, it was obvious that the system was underperforming and people were not getting the healthcare they deserved. Even when there was good evidence for best care practices, for example, methods to screen for and control high blood pressure, approximately 50% of patients weren't receiving the recommended care. There have been some efforts to revise this framework in recent years, especially to emphasize value, which is a ratio of quality and cost of care, and equity. Note also that access to care has been added as a dimension given problems with access throughout the world, and there's been an appropriate emphasis on prevention, not just acute care. By all accounts, progress in addressing these gaps has been very slow, and we encourage you to become familiar with the available data in your own area. I want to emphasize that these problems are not unique to the U.S., and if you live almost anywhere in the world, you're experiencing shortfalls in many of these issues. However, what is relatively unique in the U.S. is the magnitude of disparities in health and healthcare, particularly in the Deep South, where costs are the highest and healthcare outcomes the poorest. For example, people who self-identify as Black have higher rates of uncontrolled blood pressure and accordingly are at higher risk for stroke and myocardial infarction. I could spend the rest of this lecture showing you similar data, but the data on neonatal mortality is particularly striking. Not only are there disparities between races, but the U.S. ranks near the bottom in neonatal mortality compared to other developed economies.